Hi, I'm Dr. Scott Greenberg, and I'm going to speak with you about treatment of post-concussion syndrome. This is a treatment that's really important to me. This is how I started my career in helping patients with pain and injuries. As you may know, I was hit by a drunk driver when I was 18 years old. I suffered for 10 years with chronic headaches and neck pain and stiffness and inability to concentrate through college, through medical school, through residency, but I survived, and eventually I figured out that all the problems that were going on with my head were coming from my cervical spine. And I treated them myself in the middle of the night in a matter of desperation and injected myself and was able to fix my own problems. So that's why I'm so dedicated to this field and dedicated in helping people who have the same problems that I had. So post-concussion syndrome is a really interesting type of treatment, and when people get head injuries, whether it's from a car accident or from sports or from some type of trauma, not only does the injury occur to the head, which is what most people are looking at, but there's a lot of injury to the upper cervical spine. And we think of whiplash as only in car accidents, but whiplash happens in a lot of different types of accidents. And the reason why this is so important is because when you sustain this injury into the upper cervical vertebrae and at the base of the skull, it, number one, can produce a lot of pain. It can produce referred pain, and damage in the vertebrae here can interfere with the autonomic nervous system. And the way that this happens is the damage to the anatomy will cause compression around the area of the base of the skull and in the brainstem. And when this happens, our nerves don't function right. We can't coordinate between our eyesight and our balance organs, and between our heart rate, and between our pain receptors. So lots of things happen to patients, and fortunately correction of the cervical cranial junction, which I'm going to demonstrate to you, can be life-changing as it was for me. And not only was I able to treat myself, but I've been very fortunate to treat many patients with this problem, some who actually have become doctors and want to work in this field, and some that will become doctors that are on their way to go to medical school. In addition to that, I was lucky enough to treat 3 captains of the Philadelphia Flyers and resolve their injuries as well when they suffered. And unfortunately, even through the best of medical knowledge, that they weren't able to get better, but this treatment helped them and was life-changing.